Hey everyone, Dr. Gage here. Today I'm bringing you a video, more of an informative video, but also how we treat a condition that we're seeing appear a lot more often in our office as of recently, so we thought why not go ahead and make a video on it. Now the condition above is rather painful. It can put a damper on a lot of people's training, and that condition we're going to talk about is shin splints. This is also known as medial tibial stress syndrome. It occurs when there's excessive stress put on the lower leg, specifically the muscles of the calf, so the gastrocnemius, the soleus, as well as the muscles surrounding the tibia or your main shin bone. So we have tibialis, anterior and posterior there. Along those muscles, we've been finding clinically a lot of trigger points in that area, muscle tightness, soreness. This condition often presents with pain right over the tibial bone there. So if you're feeling that tenderness when you press around on your shin or with running, sport, things like that, this might be a condition that you're experiencing. The good news is we're finding a lot of good clinically efficient ways to treat this condition and get our patients back to their sport, whether it be running, basketball, whatever it is back to sport fast here, okay? And so we're doing that with a variety of ways here in the office. One of our main ways is our new shockwave therapy. You've likely seen videos on that in the past. It's helping eliminate those trigger points found in those muscles. And then on top of that, we're doing our instrument-assisted soft tissue work. So whether that be Graston work with scraping tools, active release technique with our hands-on manual therapy. Being chiropractors, we always adjust joint motion there. So we want to make sure that joints of the foot, the ankle, the knee, the hip, all the way up to the pelvis and low back are moving properly. And then what we're doing is we're also implementing a lot of rehab exercise into this condition. So with that, a condition that we see with shin splints is often hyperpronation of the foot as well. So as a patient or an athlete here steps down into their gait, they rotate in excessively here, causing that hyperpronation. What that does is that puts additional stress on those muscles of the lower leg. So that's why we like to focus a lot of our soft tissue work on those muscles. In the next part of this video, you'll see some of the exercises we like to do to prevent this. Some of the modalities I mentioned that we'll do in office here. And then if you have any questions, always feel free to reach out to us. Let us know if we can be of any help to you, and I'll see you in the next video. Take care. All right, so here you can see we're going to work some ankle eversion here. This is good for the outer leg muscles, as well as working some of those calf muscles that get firing with this as well. In the next clip here, we're going to work the opposite way. This is ankle inversion exercises here. Here we're working on a calf raise, but we're putting the big toe into an additional position of extension here to help work on the medial arch of the foot, which can help with the hyperpronation that we talked about. This is one of our go-to exercises here. This is a tibialis anterior raise. You lean against a wall and just raise both your feet off the ground there, kind of opposite of a calf raise. Here we're working on a squeeze, like something like a soccer ball in between the legs, and then going up onto a calf raise here, just an additional challenge for a calf raise. You can see here some of that soft tissue work that we like to do. This is Graston technique on the soleus and Achilles tendon there. Of course, our shockwave therapy here, also working on a little bit of the Achilles tendon and lower calf here. In the next clip, you'll see we then go above the region and we work into the quads with some soft tissue work as well with motion there. And then, of course, like I said, as chiropractors, some joint manipulation here. This is our intern, Matthew. He's adjusting some hips here as well as the knees with long access. This can be super beneficial.